As you know, Texas had 10,000 new COVID-19 cases just yesterday. What are your experts telling Governor Abbott and other Texas leaders about what they should be doing to slow the spread of the virus?
So we've been working very closely. I have personally, the president, the vice president, Dr. Birx, with Governor Abbott and his excellent team. And, you know, he's taking the right steps by asking people to wear face coverings in the counties that have, I think, more than 20 cases, by closing bars in the hotspot areas, by restricting indoor dining in hotspot areas. These are the types of steps that we need to take now, because while we need to reopen, we have to reopen in a smart way, and we have to behave smart as individuals. And if we don't behave responsibly, we're going to hinder our efforts to get back to work, back to school, and back to health care.
Is there anything else that Texas should be doing and Texans should be doing besides that? Some critics say that they shouldn't have opened as much.
This isn't about reopening. It's about how we behave within reopening. And then, of course, the governor is saying if we don't regulate ourselves well, then some of those types of reopening aren't going to be able to happen quite yet, like, say, the bars being open. But there are three simple things we each need to do, which is maintain social distance when we're out in public. We need to wear face coverings, especially when we're in a setting where we can't maintain a good social distance, and practice good personal hygiene. But most importantly also, every one of us should always ask the Surgeon General's three questions for the prescription to health, which is, what are my individual circumstances? Am I or someone in my household vulnerable, particularly? That means 80 and over, or somebody with 3 or more of the very bad comorbid conditions like diabetes, obesity, hypertension, renal failure. Second, what's going on in my community? Am I in a county that has really no spread of the disease, or am I in Dallas or Houston where there's a lot of community spread of disease? And third, what type of activity am I contemplating? Am I talking about going to a party at someone's house that's going to have 100 people indoors without face coverings and without social distancing? Or am I going to be taking a walk outside in the park? So if we think about those three things, we can assess our own individual role in the circumstances.
Federal support for the 5 community test sites in Texas, including 2 in Dallas, is set to expire this coming Tuesday. Is the federal government going to be extending that? Because my understanding is that the state has requested federal support through the end of the year.
Well, we're going to keep working with Governor Abbott to make sure that he's got what he needs. We're here to back him and the Texas team up. In fact, we just are deploying a new concept testing system in McAllen, Texas, that will deliver 5,000 tests per day in that community. And so we're going to be there to keep supporting Texas with testing supplies. We're surging in the supplies for the month of July that Texas needs, and we're supporting community-based testing. What you're talking about there is the old first-generation testing, really government-run. We now have hundreds of testing sites that involve the use of our federally qualified health centers, as well as ones run out of retail pharmacy systems throughout the state.
And my understanding is that because there is so much demand for it, that there have been long lines at these community test sites that are federally supported. So here in Dallas. So are those going to be given, will that be expanded, that federal support, and will they be given more tests as well?
So, yes, there have been long lines, and we have our national testing facilities. The big commercial laboratories are continuing to ramp up their capacities. One of the most important things that we've got to do, though, is get to where we can do pooled testing. That means testing everybody in a multi-generational household, say, with a single test. So you put them all together, you test, and if it's negative, then everybody's negative. If it's a positive, then you would go back and test the individuals in that household. That's the type of testing we have to move to that will radically expand our testing capacities. We're doing 600,000 to 700,000 tests per day. So we're doing more than any other country right now. We're close to 40 million tests administered, but we need to make sure it's a good experience for people in Texas, to make sure that they're able to get tests and also that they're able to get test results as quickly as possible. And we're working with the governor and all of the public and private sector entities to make that happen.
I've also heard that the state has requested from HHS military personnel, some HHS personnel, and doctors to come to the state. What can you tell me about that?
Yes, and the people of Texas, I think, should be reassured that the assessment that we've got, both from ourselves as well as from the state, is that Texas has the healthcare facilities. It has the hospital facilities, the ICUs, the ventilators, et cetera. But the challenge is enough healthcare personnel to support the use of those facilities. And so the governor has requested, and we're working to supply health professionals. So we've already deployed healthcare professionals to the San Antonio area. And we're continuing to advance on getting additional DOD and HHS personnel in there, in addition to supporting Texas with hiring contract doctors, nurses, and nurses' aides from elsewhere in the country to surge in and make sure that those facilities are available. One bit of good news that Dr. Birx spoke about in today's press conference is the fact that we are in Texas seeing what appears to be a decline in the rate of growth of ER presentations by individuals with COVID-like symptoms. So that's at least a glimmer of a positive development there.
And what about the Dallas-Fort Worth area? Have you been asked to surge personnel for our hospitals here?
We have, by the governor, and so again, we're working to get military, HHS, as well as contract personnel there to support the needs that the governor has articulated.
And is that because the hospitals are planning their surge plans? They're planning to activate them soon?
I don't know if it's connected to surge planning so much as an underlying lack of healthcare professionals to support the full capacity utilization of the facilities. So a lot of hospitals we find, especially in the southern areas in the country, will have in the summer some natural lower permanent staffing levels, and so they'll need to bring in extra personnel when they achieve higher levels of utilization like this. But again, we're working with the governor to make sure that we've assured him we're going to be there to support him and the team in Texas to make sure that everybody has whatever they need as much as we can supply it.
I know back to school is a big issue. The state laid out its protocols for people and students, teachers getting back to classes this fall. I know that's something that the administration is looking at. What can you tell me came out of your meeting today with the coronavirus task force?
Well, we continue to look at the issue of getting kids back to school, because whether it's our K through 12 kids or our colleges and universities, there's a tremendous impact for health and social well-being for kids not being back in school. There's also the impact on parents in terms of the predictability and their availability to return to work themselves. You know, for kids who are K through 12, for so many of them, that's where they get a lot of their health care. It's where they get their mental health care services. For many, it's where they get nutrition services. And that's, of course, on top of the social, physical, and intellectual development that comes from being physically in person at a school. So being at home, doing distance learning, is not cost-free, even from a healthcare perspective. And that has to be balanced against risk when controlling infectious disease.
And will the federal government be helping the states with funding as far as, you know, a lot of these schools are going to need hand sanitizer and some of them are requiring masks, et cetera?
Well, you know, the CARES Act has $13 billion of funding connected to education, and Secretary DeVos made clear today that they've drawn down, I think, about 1% of that money. So we encourage states to get on it and get focused on requesting or drawing down the money that they're entitled to under the CARES Act to support their school systems in reopening.
To vaccines and therapeutics, is there anything new?
Yes, so just yesterday, We made two major announcements advancing on both therapeutics and vaccines on President Trump's Operation Warp Speed. So we announced yesterday that Regeneron, we contracted almost $500 million with them to have the advanced research and development as well as manufacturing of what could be hundreds of thousands of doses by late summer or early fall if the studies pan out and the product is approved. That would be the next generation therapeutic on top of what President Trump has already delivered, which is remdesivir for hospitalized patients, steroids used for people with lung injury, and convalescent plasma, which is the plasma taken from recovered individuals to help treat individuals suffering from COVID. We also announced a $1.6 billion potential contract with another vaccine company that now makes 4 vaccine manufacturers that could deliver tens of millions of doses this fall and hundreds of millions of doses across all of the manufacturers early next year, assuming the FDA finds the clinical trials to deliver a safe and effective vaccine.
How likely is that to happen?
Well, it's science, so there are no guarantees, but what we're doing under President Trump's Operation Warp Speed initiative is placing a diverse set of investments. So we're going to invest in multiple therapeutics, as well as we already have 4 different vaccine manufacturers with different mechanisms of action, different platforms, different manufacturing techniques. So again, diversifying our risk by making these massive investments to ensure that we're producing vaccine. At the moment, we're going to scale up commercial, large-scale manufacturing, even as we continue to drive the development programs to study these vaccines to prove that they're safe and effective, subject to FDA's gold standard of approval.
HHS Secretary Alex Azar, thank you so much for your time today. Really appreciate it.
Thank you. Good.